Sometimes pain strikes when you least expect it. You're just moving through your day. Maybe you're bending down to pick something up, taking a walk, or even sitting still. And suddenly your muscle locks up in a tight, unbearable knot. It hits hard, fast, and often without warning. This is what we call an acute muscle cramp. And in that moment, nothing else matters except trying to make the pain stop. In today's video, we're going to walk you through exactly what to do the moment a cramp strikes. Not theories, not vague tips, but the real proven techniques you can apply instantly to reduce pain, release the muscle, and recover faster. Whether it's your calf, your foot, your thigh, or even your hands or abdomen, you'll learn how to respond quickly and safely. We'll cover the more effective stretches, proper muscle massage methods, body positions that ease the pain, and, just as important, what not to do when a cramp hits. Welcome back to Health-Wise Living, where we help you make smart, science-backed decisions for a stronger, more independent life. Especially after 40, if muscle cramps have been disrupting your sleep, your workouts, or just your daily comfort, you're in the right place. Let's begin with the first and most important step. Don't panic. When a cramp hits, it's natural to freeze or even try to tense up the surrounding muscles. But the more we resist the cramp, the longer it can last. So, the first rule, stay as calm as you can, breathe deeply, and gently begin to stretch the affected area. Let's break this down based on where the cramp happens. If the cramp is in your calf, which is the most common spot, especially at night, here's what you do. Sit up or stand, if possible, and shift your weight onto the cramped leg while keeping your knees slightly bent. Then slowly and gently flex your foot upward, bringing your toes toward your shin. This elongates the calf muscle and often provides almost instant relief. You can also lean forward slightly to deepen the stretch, but always go slowly. Never force it. If the cramp is in your foot or toes, try standing and pressing the ball of your foot firmly into the floor. You can also manually stretch your toes backward using your hands. Another trick, roll a cold water bottle or a small ball under the sole of your foot. It helps distract the nerves and relax the muscles. For a thigh cramp, especially in the hamstring, lie on your back and gently pull the affected leg toward you, keeping it as straight as you comfortably can. Use a towel or strap behind the knee to assist if needed. If it's a cramp in the front of the thigh or quadriceps, stand and bend your knee, grabbing your ankle behind you and gently pulling your heel toward your buttocks. Support yourself with a wall or chair for balance. Now, what if the cramp is in your abdomen, which can happen unexpectedly? Try lying flat and take in deep, steady breaths. Gently massage the area with circular motions and stretch by extending your arms overhead while lengthening your legs in the opposite direction. Think of creating space in the abdominal area to relieve tension. Once you've gently stretched the muscle, the next best step is massage. Use your fingers to knead the area in small, slow circles. Apply moderate pressure, but not too hard. The goal is to increase blood flow and help the muscle reset, not irritate it further. You can also use a warm compress or heating pad after the cramp passes to encourage relaxation and prevent a recurrence. Some people find immediate relief with cold therapy, like applying an ice pack wrapped in a towel for a few minutes to reduce nerve activity. Heat, however, is better for loosening tight muscles after the acute pain has settled. Here's another helpful tool: hydration and electrolytes. If you're able, sip some water or an electrolyte drink right after a cramp. Dehydration and mineral imbalances are often behind these episodes, especially in warmer weather or after physical activity. Let's talk briefly about body positions that can help during a cramp. If you're lying down, try to elevate the legs slightly with a pillow to improve circulation. Avoid curling into a ball, which can make the cramp worse. If you're standing, shift your weight gently and don't lock your joints. Now, here's a very important section: what not to do during a cramp. Don't yank or pull the muscle forcefully. You might cause a strain or even a tear. Don't jump up or walk immediately without stretching first. It could trigger another cramp or worsen the pain. Don't apply deep pressure or pound the muscle. Gentle is the key word here. Don't ignore frequent cramps. If they happen regularly, it's time to look deeper. Your body is trying to tell you something. So let's recap the acute cramp rescue plan. 1. Breathe and stay calm. 2. Gently stretch the affected muscle. 3. Massage in slow, circular motions. 4. Use the heat or cold therapy depending on what feels best. 5. Rehydrate and restore minerals if possible. Avoid forceful movement or pressure. Remember, the goal isn't just to stop the cramp, it's to reduce soreness afterward and prevent the next one. Once the pain passes, take a few moments to walk gently, loosen up the area, and check in with how your body feels. This awareness helps you respond faster and more effectively next time. Now, this video is about what to do during a cramp, but the bigger picture is preventing cramps altogether. That's what the rest of this series will focus on. In future episodes, we'll dive into the foods, nutrients, and movement habits that actually reduce your risk of cramping over time. You'll learn how to make simple daily changes that keep your muscles relaxed, responsive, and healthy. So, if you haven't already, make sure to subscribe and hit the notification bell. That way, you won't miss any of the upcoming videos. And before we finish, one quick but important note. Disclaimer. This video is for educational purposes only and is not medical advice. If your cramps are severe, persistent, or accompanied by swelling, weakness, or other unusual symptoms, please consult a healthcare professional. Always check with your doctor before starting any new exercise, therapy, or supplement routine. Thank you for being here with us today. I hope this video gave you practical tools you can use the next time a cramp sneaks up on you. Stay strong, stay curious, and remember, knowledge is power when it comes to your health. Until next time, live wisely.